Unsteadiness while walking, memory and recognition problems might sound like symptoms of Alzheimer's or Parkinson's disease, but it could be something much more treatable. And here to talk about this is Dr. Marie Yost, a neurosurgeon with Providence Brain and Spine Institute. Dr. Yost, tell us about NPH. What is that?
It's an excess amount of spinal fluid, the liquid that circulates around the brain and the spinal cord that cushions it.
And how does one get that, or how does this come about?
No one knows exactly why some people develop it. It's usually found during a workup for symptoms of dementia.
Now, we mentioned a few of the symptoms, memory and recognition problems, having trouble walking or trouble urinating. What are some of the other signs that a person might have NPH?
That's pretty much the classic triad, having unsteadiness of gait, difficulty with urinary incontinence, slowed thinking, or memory problems.
Okay, so say somebody does have that. What is the treatment?
Usually it's found during that workup for dementia, and you see that the spinal fluid spaces in the brain are larger than would be expected. And we can test to see if people will respond well to surgery by doing a spinal tap and taking off some of that extra fluid, and then we should see the symptoms get better.
Okay, so I'm sorry, go ahead.
Oh, sorry. And then if that's the case, we can put in a shunt.
Okay, now talk about those shunts. How long do they stay in place? And can having the treatment help eliminate all of the symptoms? And is it a cure? Does it last for the rest of your life?
So the shunt is a small tube that's inserted into the spinal fluid spaces in the brain and then drains the fluid down around the intestines in the peritoneal cavity. And that has a little magnet so that we can program it through the skin to take off different amounts of spinal fluid as needed to help that individual person. Those do stay in for life, and if people have a good response to that, they can actually substantially reduce or completely eliminate the symptoms that they had.
We always love when we do a medical segment and we can find a cure or something that will alleviate the symptoms. Always like talking about that, Dr. Yost. Thank you very much.
Thank you.
That's Dr. Marie Yost, a neurosurgeon with Providence Brain and Spine Institute.